Hi, everyone. Thanks for tuning in. My name is James McReynolds. I'm the head of programs here at the Bullock Museum. And before we get started, I just want to say that I hope all of you are safe and healthy. I know that COVID-19 pandemic has changed things for all of us, and we here at the museum are adjusting too. We're shifting all of our programs online, so we're able to connect with you through events like this. And so keep an eye out for more online program content coming out soon. Speaking of COVID-19, it's been on my mind a lot lately. I'm sure it's been on yours too. And sometimes when I'm thinking about current events or topics, I find it helpful to just look back at our history, not just to take a break from the news cycle, but to provide some perspective on things too. So I thought we'd do that today as we explore another epidemic in Texas from our not too distant past. I'm lucky to be joined in this talk by Dr. Heather Green Wooten. Dr. Wooten is an adjunct assistant professor at the Institute for Medical Humanities at the University of Texas Medical Branch. She's author of the book, The Polio Years in Texas, Battling a Terrifying Unknown. Dr. Wooten, thank you for joining me.
Well, thank you, James. It's a pleasure.
So, just to set the stage, when were the polio years in Texas and what was going on at the time?
Well, the peak polio years were 1943 to 1955. Even though has been around for centuries and epidemics began in the late 19th century, but the peak of them were those years. And of course, when you think 1943 to 1955, you are certainly thinking about World War II and the Korean War, and a time of great promise, but great upheaval and transition. So I would say, in terms of, what all was going on, well, I guess in terms of promise, you had the soldiers are coming home, and, those coming home from the wartime industries, they're marrying their sweethearts, they're having children, lots of them, 76 million, in fact, during the baby boom, 20 years, known as the baby boom years. But it was also a time in which science had uh, great promise as well. Here we were emerging from the war, the technological industrial leader of the world, and science had a lot to do with that. It also had to do with some medical breakthroughs that were occurring at the time, including the discovery of and implementation of penicillin. And I think, think of this is the beginning of the space race. And so a lot of individuals who thought laboratory science was rather dull are now thinking of that as what they might want to be when they grow up, or what their career would like. They'd like to pursue a career in that way. So those were definitely the promise. Now, of course, the tensions is we are now in the atomic age, and communism is on the rise. And we just got through with one war, and now we are into another one. As I said, the Korean War. It is the rise of McCarthyism on our political scene. So the way we approach polio is going to reflect all of that promise and that tension.
Yeah, it's a very important part of the time in American history, that's for sure. Not to get too technical on the scientific side of polio, but can you at least describe for us what the sickness was like and what the symptoms were for people?
Certainly. Well, polio is caused by a virus that is ingested through the mouth, by way of, unwashed hands or a contaminated object. And for the most part, it travels down through the digestive tract and then is shed out. And that is 98% of your cases were a mild case in which that occurred. And the symptoms would be that of the flu, runny nose, a fever, some achiness, and then it would dissipate. Now, in about 3%, 2 to 3% of your cases, that is when you have paralytic polio. When the virus breaks, when it is ingested, it breaks through the intestinal wall. It enters the bloodstream and then attacks the central nervous system, specifically the anterior horn cells of the spinal cord. When that occurs, then you've got paralytic polio. And then that comes in two forms. You have paralytic where it is just you are paralyzed in extremity, or maybe both, waist down, neck down. It came in all different manifestations. But then at times, the virus would then attack the respiratory system and the diaphragm, your muscles used for breathing. And then when that occurred, then that's when it's incredibly dangerous, because you will suffocate if you do not have access to a respiratory assistance within 48 hours. And then, of course, the worst kind you possibly could have, the most dreaded of all, was paralytic, bulbar paralytic polio, when you are paralyzed on certain parts of your body, and also your breathing is compromised as well.
A pretty scary disease. I imagine the Pope was probably scared about this. What was their general reaction?
Oh, they absolutely were. As you can imagine, and one of the reasons is who it is affecting. Number one is children and young adults, and it is incredibly contagious. We definitely knew that. But the other reason is it struck everyone, regardless of geographic region, neighborhood, ethnicity, race, economic status. It was the great equalizer. It hit across the board. Now, even though in urban areas, it would strike perhaps more often, more intensely, because you have a larger population there. But it's certainly, there were certainly times when small towns endured some horrendous epidemics, as did rural areas as well.
So was the reaction similar to today? I mean, how did the fear manifest itself? Were people hoarding toilet paper, or how was it handled?
Well, there was no hoarding, and we didn't have shelter in place per se. In other words, not the whole, the whole economic structure was not paralyzed. But what was very frightening was we did know, again, that it was contagious, but we had absolutely no idea how it was transmitted. So there are all kinds of ideas. And so, what does the medical and the public health community do if you don't know? Well, you go to your playbook. What worked in past epidemics? So if it was insects were suspect, which makes complete sense, because they're the vector for yellow fever and for malaria. So there were a lot of times during the height of those polio years where the people I know will remember the DDT trucks were coming down your street and spraying your neighborhood. And then also counties would rent planes that would spray DDT across wide swaths of counties, at the same time. So that was certainly, one safeguard. Of course, one thing that we would be very familiar with is, sure, the economic structure, not all businesses closed, but certainly businesses which would have attracted children and young adults. So we're talking your entertainment venues, theaters, swimming pools, summer camps, Sunday schools. Those type of places would close. And then also polio would creep in the summer months. So children were kept indoors, and their nutrition was strongly monitored by their parents, and naps were a must, which, every child growing up at that time, certainly remembers that. So those were certainly some of the safeguards. At times, people thought even, far beyond just those general ones, such as dairy was suspect at one point. In the epidemic of 1949 in San Angelo, that's a really interesting one, in which but I think very characteristic, which was that during that epidemic, travelers were afraid to drive through town. And they certainly didn't stop and put air in their tires for fear of taking polio back out with them. Even there were some individuals who were afraid to talk on the phone for fear that polio transferred through the phone lines. So there are all these theories that and fears going on. Physicians themselves would certainly, during that acute stage of polio, which lasted the first 2 weeks, polio patients, if they were admitted to hospitals, they were put in an isolated ward, and physicians and nurses would administer care masked and gloved, just like they do today. They had the PPE for sure. The other thing, with physicians is certainly nurses. I remember telling me that they had to change their clothes before leaving the hospital or even going. You could not get on public transportation because the bus driver wouldn't let you on if you're in a nurse's uniform, because that meant you might be a carrier. So, but all of those are, polio just ran the gamut in terms of the reaction.
You mentioned PPE, and that's definitely something that's in the news a lot today. Having protective equipment available for hospital workers, and then ventilators for patients. Always worried about there being a shortage of those right now. Was that a similar problem back then, or were they worried about having enough resources to help fight this epidemic?
Oh yes, they most certainly were. When you think about it, if you have an epidemic in a small town, just like we would have today, if COVID hit, but certainly if you in a small town and all of a sudden you have these patients coming down with bulbar polio, and the closest iron lung is 2 or 3 hours away, because most hospitals at that time didn't have the funding, they didn't have the staff to keep those iron lungs and certainly keep them in operation. So then that would put that patient in very dire circumstances, and a lot of them would die en route to the hospital. So actually the game changer for resources came by way of the National Foundation for Infantile Paralysis, or the March of Dimes as we know them now. They began in 1937 as in response to the increasing number of polio victims per year. But so certainly by the height of the polio years, what the National Foundation did is it raised money for equipment, for hospital stays, for iron lungs, for outpatient visits after the patient went home, all of those type of things. Because keep in mind, at that time, you had some employers were definitely ramping up employer-based health insurance, but a lot of people didn't have it. So this was out-of-pocket cost. So the National Foundation was a grassroots organization. You had community chapters everywhere. Then you had regional, state, and then of course the national chapter as well. And that's what they did, is they raised money for polio treatment, for care, and for research for an effective vaccine. So a story that I enjoy telling to give an idea about resources is, due to the shortage of iron lungs in a lot of these towns, and the National Foundation decided to build polio respiratory centers in hot spots throughout the nation. And Houston was certainly one of those. Houston was the hardest hit, Harris County was the hardest hit county in the nation throughout those peak polio years, except with one exception, and that being Los Angeles, California. So the first one was created in Houston, certainly with the cooperation of Baylor College of Medicine. And what it did is they said, okay, let's build these centers in which we put all of these iron lungs, a lot of them in one space. Line them up in a row so that you can put all these patients in there. They have a nurse, a caregiver, round the clock treatment, and that will, that will help more individuals survive, which it most certainly did. Your mortality rate from bulbar polio plummeted with the implementation of these respiratory centers. And when we think of modern intensive care today, the forerunner of it was these respirator centers. That's where we became acquainted with that concept. So in addition to the March of Dimes, though, the other people who are putting a lot on the table, we must never forget, are these fraternal organizations and like Shriners and Lions Club and Rotary. And they are also building treatment centers and donating to the polio cause as well in a big way.
So outside of fraternal organizations and the March of Dimes, what was the role of the state and federal government? Seems like today it kind of varies from state to state, city to city. Was it similar back then, or was it really different?
Well, it did vary in the fact that epidemics just leapfrogged throughout the country. You might have, San Antonio might have it in 1956, and then they don't have another one until 1952. But then it's hitting somewhere else. And there was really no rhyme or reason exactly where polio is going to strike at any given time, which was the other reason why the public was so frightened of it. You just never knew when, who's next. So what the response would be then is it would come out of these counties of which you're having an epidemic. That's going to be kind of the primary push. The primary is through these municipalities and these counties overseeing those municipalities. Statewide would get involved, but not to the extent that they did. They just kind of gave the oversight. The federal government, though, was mainly involved in developing a vaccine. So through the National Institutes of Health. When the Department of Health, Education, and Welfare was created in 1953, the first secretary was Texan Ovida Culpabi. And so she was in charge of overseeing the testing of that Salk vaccine and its production and its ultimate distribution. So, again, most of the care and the response came from local entities, everything, their medical and the public health combined.
So was the disease or the government response to it ever politicized at all during those years?
Well, yes, but not in the partisan way of which we have today. It was not a partisan outlook at all. Where you would say the politicization came from was in two directions. Number one is, keep in mind that one of the most famous polio survivors was a very popular president, Franklin Roosevelt. And he's going to be the figurehead for the polio cause, and definitely a figurehead for March of Dimes grassroots initiatives throughout the country. But another important factor is that here we came out of World War II, the economic industrial leader of the world, and we had come fighting for American ideals, the preservation of American ideals and American values. And what better place, the primary group that is going to sustain those values and those ideals are your children. They are the embodiment of the American dream. They are going to be the future of it. So if this disease is attacking your hope, your future, then that is where the March of Dimes became to be kind of a political way of looking at things. It was very closely linked to patriotism. That you're fighting for your country and you're fighting to defeat polio at the same time, because they are very intricately linked. Mm-hmm. And this is also keep in mind, this is a child-centric population that we have. America is very child-centric. So if you think of the poster children, they used these sweet children that were suffering in some ways from polio, and they would be poster children. You had it on the municipal, the county, the regional, the national basis, and nothing pulls at your heartstrings and opens your wallet more than this sweet child and embraces, or who is debilitated. So that was also the way of, come and save our children, and, donate and support the polio cause.
Worthy cause for sure.
Oh, yes, yes.
So you mentioned the formation of what we now know as the ICU, the intensive care unit. Were there any other public health innovations or efforts that came from the efforts to combat the virus?
Yes, there absolutely was. For one thing that came out of those polio years was these rapid increase or rapid interest in these particular medical specialties, like orthopedic surgery. Pediatrics became a viable specialty that a lot of individuals coming out of medical school then wanted to enter due to the polio years. Also, it's definitely spearheaded the development of rehabilitation medicine. In addition to orthopedic surgery and some of the things that came out of that, some of the, like the Harrington rods to remedy scoliosis, you had physical therapy, certainly the popularization of hydrotherapy, and then of course all these rehabilitation institutions throughout the nation in which you have physical therapists and gaining traction. So there's definitely that. And then again, as I said, the respiratory centers was certainly the opening of modern intensive care. And then of course, I'd say the last thing was that polio stimulated the field of virology in a very big way. Now, if you want to go away from the public health institutions, what I think is also fun is it certainly contributed to our toy industry. For one thing in particular is the game of Candyland that we all played as kids. That was developed in response to children who were kept at home, bored during the summer. And this was something they could either play with their sibling or they could play by themselves. And so, Milton Bradley made a killing off of Candyland.
I know all my fellow parents of young kids are going to be thinking of any kind of game or activity we can get our hands on here, so long as we're still staying at home. That's
right,
good.
It'll be interesting what has gained popularity and that might stay for a while.
Exactly. So when did the vaccine come out and how was it received? Was it universally hailed when it came out?
Oh, it absolutely was. It was the vaccine, Jonas Salk out of the University of Pittsburgh began to work with the National Foundation for Infantile Paralysis beginning in 1952. They gave him a lot of money to develop this vaccine because he had been working on it. And so he received an inordinate amount of funding to develop that, he and his laboratory and subsidiary laboratories as well. So he began to test it on a very select group of individuals in 1953. And then in 1954, we had what we know as Operation Polio, which is before the vaccine can be just, put out there for the public, it has to be tested. And who better to test it on than your first, second, and third graders throughout the nation, because they are the group that is the most susceptible to it. So you had these children lining up, 650,000 of them throughout the nation. And with the Salk field trials, then in 1955, 1 year later, which was on April 12th, the 10th year anniversary of Franklin Roosevelt's death, they announced that the Salk vaccine is safe and effective. Now, it is safe. His vaccine, though, was geared toward paralytic poliomyelitis, not polio across the board. So it was a 3-dosage vaccine, and it went straight into your bloodstream, and then formed these antibodies to ward off an attack of polio virus if it worked its way through past the digestive tract. So the intestinal wall, I'm sorry, is what I mean. Now, that was about 65 to 75% effective, which was wonderful when you had absolutely nothing before that. Now, several years later, about 7 years later, you had Albert Sabin, who had began his polio research as early as when he was overseas in World War II. And he is looking for the idea of creating a vaccine that would produce a herd immunity, because again, it is shut out. So to be able so that, everyone would be protected, and it would take care of that mild form of polio as well. So that was implemented in 1962. I think a lot of people remember the sugar cube, and they sometimes get that confused with the Salk vaccine that was injected. But the sugar cube, which a lot of people had for, that was their first polio vaccine, it was mine, was implemented during that year. And everyone took it from age infancy all the way to 90 years old. Everyone took that vaccine in order for it to create the herd immunity, which it did. And after that, polio, the caseload really plummeted. It just became almost non-existent in the United States. Yeah.
So what was the overall human toll, both physically and mentally, for folks after all of this finally came to an end?
Well, it's hard to be able to say for sure what the human toll was, because record keeping was certainly not as sophisticated as it is now. Now, I did a count. I did a count of what a loose estimate of cases from 1943, say, to 1955 on a national scale. I'd say it was about 500,000. On the Texas scale, it was about 25,000. That doesn't seem like a lot, and I understand that, but that is just from reported paralytic cases. Otherwise, actually, just about anyone who lived during that time had a case of polio. They just didn't know they did. Mm-hmm. And that is what made it so dangerous. And is because you could have someone who has no idea they have it. They might have a symptom of a runny nose at that, and give it to someone else inadvertently who'd come down with a full-blown case of bulbar spinal. It was just terrifying. And that's why they knew, scientific community knew, there is absolutely no way you're going to cure this thing. You have got to create a vaccine for it, which they then did.
So, thanks for sharing all of this with us. What are some lessons you've learned through all the research you've done on the topic and writing the book about this period in Texas history that you think we should keep in mind today as we're going through this COVID situation?
Well, I think there's probably three that I have that are primary. One of them is, back in the early 1970s, there were two very well-known epidemiologists who, in reaction to the massive immunizations that were available by then, and also the increased development of antibiotics, they pretty much proclaimed that, infectious disease in the future is just going to be really dull. Because no one is going to have that now, or it's going to be very rare. Well, of course, as we know now, 50 years since then, we know that is certainly not true. When we've encountered SARS, we've encountered AIDS, we've encountered Ebola, and now we've got COVID. And so what I think one of the primary lessons to learn is contagious diseases, infectious diseases, are going to always be with us. And it's going to be exacerbated with the increase of climate change and the global world in which we live in. So I think a primary lesson is, which they definitely learned in the polio years, was scientific and medical preparation is key. And Texas certainly did its part with that. I think a second one dealt with just how important the medical community is. And it's not just the physicians, it's all the way across the board, from physicians all the way down to your custodians, your food workers, and everyone in between, how essential they are. And I know from interviewing individuals who remembered the polio years or who were, polio survivors, there were several individuals, from physicians all the way down to the hired hand who wheeled them around the, rehabilitation campus, that they had these favorite individuals that they warmed to, those were the individuals that meant the most to them. So everyone's contribution is incredibly important, and we definitely are seeing that today. And then I think finally, it's just, the third one is the essentiality or the essentialness of community. We are all in this together. Even though disease is individual, but it is also collective. And it is only through participation of individuals community-wide or statewide are you able to beat back and defeat a devastating disease. So I think we've definitely learned that no man's an island. Community is incredibly important, and we all can do our part. If it's providing information, sharing resources, just showing compassion, taking a look at the most vulnerable among us. I think that's that's the primary lesson, I think.
Well, that's great. That's a great positive note to finish on. Thank you so much for taking some time to talk with us today. And thank all of you for tuning in to watch too. You can keep up with all of our programs online through our website, thestoryoftexas.com, by visiting our YouTube channel, our Facebook page, or any of our social media channels. Thank you all again, and thank you, Dr. Lee.
Thank you so much for having me. I enjoyed it. It was fun.